Hello everyone, I'm Gil Ton. Welcome to my channel. This channel is dedicated to Master Tung Acupuncture in Taiwan. And today I would like to talk with you about Mu points. Excellent points to treat the nose and the eyes. So stay with me. Okay, so Mu points, originally they were published in 1973 in Master Tung's original book. Some sources suggest that it's a set of 2 points, while sources coming from Taiwan suggest that it's a set of 3 points. Okay, it's Mu Yi, Mu Er, Mu San. So basically, Yi Er San, it's numbers in Chinese. Yi, it's 1, Er, it's 2, and San, it's 3. So it's the first Mu, second Mu, and the third Mu. Okay, these points are located on the palmar aspect of the index finger. As I said, it's a set of 3 points located on the margin of the proximal phalangeal bone. Okay, it's on the ulnar line. So in that finger, in the index finger, on the radial line, we have a set of 3 points, very important points in Master Tung Acupuncture, known as 11.123. Xiao Jian, Da Jian, Ce Jian. Okay, we will talk about them next time. In terms of how to locate the points, you have the explanation over here, but in a second, I will show you how to locate the point and how to needle the point. Okay, in terms of needling depth, all the points on the 1-1 area, the needling is quite superficial, so it's about 0.2 to 5, it's on perpendicular, and we needle the point on the opposite side. So the reaction area of these points is the liver. Okay, so in Master Tung's acupuncture, whenever we see one of the terms of the 5 phases, we see Mu, or we see Huo, which is fire, or we see Tu, which is earth, or we see Jin, which is metal, or we see Shui, which is water. Okay, whenever we see one of these terms, the 5 phases in the point names, it means it can treat the associated organ according to the 5 phases theory. Okay, so in that case, Mu points can treat the liver, while points who has Huo, fire, can treat the heart, while points who has Tu, earth, can treat the spleen, while points who have Jin, which is metal, can treat the lungs. And last, point who has Shui, water, can treat the kidneys. Okay? In terms of indications, basically, the indications are divided into two types of indications. The first one is mainly to open the orifices and to affect the face and especially the eyes and the nose. Okay, so these points are excellent. They have a special effect to treat eye disorders like dry eyes, watery eyes, or tearing eyes with exposure to wind. Okay, so we can explain that according to the association of the points to treat the liver. And second, these points are excellent to treat nose disorders like sinusitis, rhinitis, common cold symptoms, especially affecting the nose. And we can understand that according to the area where the points are located. Okay, so the index finger and this area over here, it's the area of the lung. Okay, the lung line is in this area. So we can see many set of points in the index finger to treat the lung due to that. Okay, so these points as well as the ability to treat the nose because they are located in the area of the lungs. Okay, the second group of indications is mainly the ability of these points to dredge and drain the liver and the gallbladder, but mainly the liver. Okay, so it means for example, irritability due to hyperactive liver yang, bitter taste in the mouth, okay, signs of liver heat, hypochondrial pain, tinnitus, which is the flaring upward of the liver yang, itchy skin and eczema, especially eczema in the fingers, cracked skin in the fingers area. Okay, these points are excellent. In this type of condition, we needle the points on the same side where we have the eczema in the fingers. Okay, so basically this set of indication, it's this ability of the points to dredge liver fire, liver heat, and some sources are suggesting that these points also they can drain and dredge liver heat from the even from the lower jiao. Okay, how we can explain why these points are so useful for upper burner, middle burner, lower burner disorders? We can see it through imaging. Okay, through microsystem. Okay, so in Dr. Li Zens book, this image is coming from his book, and basically it provides us an explanation of points on 1-1. So these points are 1-1, 0-1, 0-2, 0-3. Okay, and these points are 1-1.17 mu points. Okay, if we take the straight microsystem, okay, we take the phalangeal bones. Okay, so the upper area of the bone can can image the head and the upper burner. Okay, so it can explain why these points are so useful to treat the eyes and the nose and the face. Okay, and the upper jaw, the lungs. Okay, and if we take it and flip it to the other side, reverse microsystem. So this point has the ability to treat the middle burner and the lower burner. So for example, 小剑, 大剑, 次剑, 1-1, 0-1, 0-2, 0-3 are excellent points to treat Shan disorders, a disorder that's located in the lower jiao. Okay, so let's see how we needle these points. Okay, so this is the palmar region of the index finger. Okay, and this is the proximal phalangeal section. Okay, so in this section, these are the borders of this section. Okay, what we want to do is we want to divide this section into half. Okay, and then the second move, okay, is located in this line. And then from the middle of the proximal phalangeal section, we want to divide it into quarters. Okay, so then this is the third move, this is the second move, and then the same we are doing on the lower border. Okay, on the lower border, we divide the middle part and the junction into half, so it's a quarter. Okay, and then we have 3 points. What's important in these points is that we want to be close to the margin between the bone and the tendon. Okay, so this area is quite sensitive. So today I want to show you a solution of how to use these points without causing your patient unnecessarily pain. Okay, so I'm using press tech. Okay, so I'm taking a press tech and I'm putting it just next to the bone. Okay, this is the first bone. And this is the second point. And this is the third point. Okay. And then I'm taking this tape, okay, and I'm covering the point with the tape. So basically, you can leave it like this for the entire treatment, obviously. But if you trust your patients, if it's a patient that he knows what he's doing, okay, you can send it you can send him home with the press deck and ask him to leave it for 24 hours or even longer than that. I would say up to 48 hours, it's not a problem. Okay, so basically the points are being covered by the tape, and you can send the patient home with the press deck. And in that way, we are constantly stimulating the points with the press deck needles. Okay, let's take it off and I'll show you how to locate and needle the points. Okay, so in terms of the location of the points, let's put a sticker so you can see. So the first move is the middle line is the second move. Okay, so let's start with the second move. Let's put a sticker, and then we will divide the lower part. Okay, so this is the middle line, this is the junction. We divide it into half, so it's a quarter, right? This is the first move. The second move is the middle line, and the third move is at the top. We take the middle line and the junction of the bone, and we put it in the halfway, which is a quarter, right? So we have 3 points. Okay, just next to the margin between the bone and the tendon we have over here. Okay, so let's needle the point. So I will use a 0.16 needle. Okay, so the needling is perpendicular. These points are more sensitive. Okay, this is the first point. This is the second point. And the third point, just next to the bone, and quick penetration. And we have Mu E, Mu R, and Mu San. I hope you can see them. Okay. So in terms of point combinations, okay, so the first example I put here is how we can treat, for example, eye disorders. Okay, so I'm not talking specifically about any specific disease. Okay, I'm just giving a general description of how we can think of using Mu points with other points. Okay, so if we have a left side eye disorder, okay, so we can put the Mu points on the right side. We can combine it with Zhu Yuan point. So Zhu Yuan point are located on the thumb, okay, in the area of the thumb. Okay, it's a set of 2 points, very good for eye disorder. Okay, and as well on the same side where we have the disease, we can put points on the foot. Okay, so the foot of the leg image the head. Okay, and we have a set of 4 points of the 4 flowers. Hua, Hu, Yi. Okay, so it's the first flower bone. Okay, it's 5502. Okay, and these points are very good to treat the eyes. Okay, and last, we can treat points on the thigh. Okay, so in this case, we will choose the points of the liver. Okay, the upper 3 yellows. Okay, 8, 8, 12, 13, and 14. 8, 8, 12, as several indications to treat eye disorders, okay, due to the relationship to the liver, okay? And this example is how we can treat nose disorders. So for example, sinusitis, okay, acute sinusitis or chronic sinusitis, okay? So basically, in terms of size of the nose, we can ask the patient which side is more severe, or which side is blocked, or which side of the nose is open, okay, and according to that we can choose the side of the treatment, okay. But in terms of point combination and point pairs, okay, we can combine mu points with Ling Gu Da Bai, obviously, okay, Ling Gu Da Bai affecting the lung, okay, and on the other side we can use the combination of Ren Shi, Di Shi, and Tian Shi, 3, 3, 13, 14, and 15, okay. They are also treating the lung, okay. So patients with sinusitis, usually they have a lot of phlegm in the head, in the face, usually they cough, okay. So this point pair will be very good. It's excellent to treat asthma, but also sinusitis and common cold, okay. Then we can use Sima points, obviously the 4 horses on the thigh, to affect the lung, okay, to treat the lung. And then last, we can use Menjin 6-6 area, okay, and we can take a line from Menjin going all the way to the medial, okay. So Menjin is in the middle of the foot, okay, and this line is going up towards the nose, which is in the middle of the face, okay. So this is an example of how we can use mu points with other point pairs, okay. So if you like it, you are welcome to press the like button and share the knowledge with our wonderful TCM community. And that's it for tonight. So thank you for your listening, and see you next time. Bye bye.